Sharice Doyley was in labor back in 2024 when the hospital she was attending called for an emergency hearing so that she could be forced to have a C-section. Florida State's Judge Michael Khalil, basically informed Doyley on her 12th hour of contractions that the state had filed a petition against her, not necessarily out of the concern for Doyley's health, but out of concern for the health of the child. Now, why is this important, you may ask? Because this woman right here, Miss Sharice Doyley, had refused to undergo a C-section based off of the premise that her last 3 C-sections had brought many complications to her, and one including a hemorrhage. Now, it is important to note that during the hearing, Doyley was very 100% aware that the doctors were more concerned for her experiencing uterine rupture while vaginally delivering her child. But she also understood, as an experienced doula, that the percentage would be less than 2% of that happening. Now, where this story gets tricky is this right here. In the state of Florida, there are many medical procedures and laws that are passed to protect the needs and concerns of an unborn child. This is what you call the fetal personhood. In the state of Florida, the fetal personhood basically suggests that fetus has the same, if not more, rights than the woman or the person that is sustaining it. So also in the state of Florida, there are many medical procedures that would restrict the rights of a pregnant patient. It's also important to add that the doctor who was handling Ms. Doyley's case, Dr. Erin Burnett, already suggested in the clearing that she did not feel that Ms. Doyley was fit to have a vaginal birth due to the fact that the complications of her having a vaginal delivery before resulted in stalled labors. However, where the story gets a little uncomfortable and race is invited into the conversation is when Doyley voiced her complications with being at a hearing with no attorney and no professional representative, and she felt as though there was 20 people in a hearing that were white and who were going against her wishes and challenging her medical concerns. For her comfortability, she felt that it would be necessary to either have a black nurse or a black doctor present, which of course resulted in a non-black man, Judge Khalil, telling this woman and dismissing her concerns because he did not feel race was important in this conversation or was a contributing factor. Which brings me to this question. Should it be a legal requirement for a representative of that ethnicity to show up in a hearing if a pregnant patient does not agree or adhere to the medical necessities of a procedure or surgery? Should it be required legally, if a court hearing is to happen, for that person to have representation, not just by an attorney, not just by a doctor, but of that race? Let me know what you guys think in the comments down below. If you feel that it is racially necessary to have representation in these certain instances, or is this just a question of human rights?